over 657,000 registered refugees in Jordan, mainly Syrians. Nearly 165,000 are childbearing age women and around 16,500 are pregnant at any time. Globally, 60% of maternal deaths happen in humanitarian settings while fleeing wars or natural disasters. Zaatari is Jordan's largest refugee camp. It opened in 2012 to host Syrians fleeing the war. Today, over 81,000 people live here. 2,000 women are pregnant at any time in the camp. 29-year-old Etemad is one of them. She's from Dera in Syria, a dozen kilometers away from the Jordan border, and is 4 months pregnant.
This is my 5th pregnancy. My children are fine. I had my last 2 here. I think if I had had my latest one in Syria, he would have died, especially considering the present situation.
Etemad has a high-risk pregnancy, having suffered complications before. She's monitored at the UNFPA Reproductive Health Clinic, run by the Jordan Health Aid Society, NGO.
We have between 100 and 120 patients per day. Among them, between 70 and 80 are pregnant women. During the first 3 months, we see them monthly, every 2 weeks during the second trimester, and from 36 weeks, we see them weekly until they give birth.
The clinic opened in 2013. It's part of one of several UNFPA-supported centres, partially financed by the EU Department of Humanitarian Aid. The facility today can assist 4 women giving birth at the same time. There have been more than 5,500 deliveries in 3 years.
We have an average of 10 deliveries per day in the camp. 8 are normal deliveries, 2 are caesareans, which are referred to the Moroccan hospital in the camp.
This is the 5,676th baby born in Zaatari since the clinic opened. Here, the birth rate is higher than in Jordan and not a single new mother has died.
Little Ward is the first baby for his 20-year-old mum. She'll be monitored for a day or so to look out for any complications. In the first hours after women give birth, the staff introduce hygiene measures and discuss family planning so that women might, for example, consider spacing out pregnancies more.
After any crisis, after catastrophes and wars, populations are prone to having more pregnancies in order to balance the losses they've had during wars.
Women fleeing wars are often deprived of quality health services and forced to give birth in dangerous and unsanitary conditions. The EU Department of Humanitarian Aid support for the UNFPA clinics is part of a wider European intervention for refugees in Jordan.
EU humanitarian aid has been here from the onset of the conflict, allocated basically 250 million euros to assist Syrian refugees and the host communities.
Peter, how important is it to provide women with a safe environment in a refugee camp, and especially when they're giving birth?
At any moment in Zaatari camp, about 2,000 women are pregnant, and 20,000 women and girls are of reproductive age. So it's a massive problem and a huge needs.
Women in refugee camps are exposed to trauma, disease and gender-based violence. Forced child marriages are growing in the camp, and 10 to 15% of mothers in Zaatari are under 18. In this safe space, activities for girls focus on prevention.
Some girls get married at 13 or 15. We use role play, like in the theatre, to raise awareness against child marriage and also to communicate these values to the family and the rest of society.
Maternal health measures, healthcare services, psychological support and cultural activities aim to help mothers like Etemad, making women more aware and giving them choices when it comes to raising their families, even as refugees.